This is Dr. Jameson Wong. I'm a NUCA doctor, and you're listening to Just Warrior It, a podcast where we believe your health is worth fighting for. All right, here's another episode of Just Warrior It, where we believe that you need to fight for your health. My name is Dr. Jameson Wong from Optimum Chiropractic. I have a guest with me today, Dr. Derek Tong from Center for Vision Development Optometry. Hi, Dr. Tongs.
Hi, Dr. Wong. Thank you for having me today.
Great. So, Dr. Tong, you're not a typical a standard general optometrist. You're a neuro-optometrist, correct?
Yes, I have been in practice as a doctor of optometry for almost 28 years. And after graduation from optometry school, I've received additional postgraduate training in the areas of neurovision rehab and vision therapy. Yeah.
Oh, great. So what is neuro-optometry? How is that different from your general optometry?
Yeah, so the main difference is in neuro-optometry, we focus in diagnosis, evaluation, and treatment of vision problems that had affect people with neurological issues such as concussion, brain injury, car accidents, and stroke. Yeah.
Oh, wow. Okay. So people that have like accident injuries like what you described. So So can you tell me what inspired you to become a neuro-optometrist versus a general optometrist?
Yeah, so after optometry school, I get to look into this various special areas in optometry. One that interests me is the area of vision development and neuro-optometry rehab, because we get to really know the patient, find out what the problems are, what the symptoms are, and do a little bit of detective work, evaluate their signs and symptoms, and come up with a treatment plan to help them. Yeah.
Good. So you wanted something more challenging and to, like I said, do detective work to be investigating what's going on with the body and taking different approaches to it.
Exactly, yeah. Mm-hmm.
Okay. Well, just to go a little bit more about neuro-optometry, for someone that doesn't know anything about neuro-optometry, how would you explain it to them?
So basically, it is to help people who have developed some type of vision problems after an injury, for example, after concussions or traumatic brain injury. And as many as 80 or 90% of individuals will develop some type of vision symptoms such as light sensitivity, double vision,
Oh, wow.
fatigue with reading, or the eyes hurting with computer work. Yeah.
So why does the vision problems like that, those challenging ones, occur after like those concussions and car accidents that you're describing?
Yeah,
how does that work out?
Great question, Dr. Wong. There are many reasons, many theory. As we all know, after a concussion or brain injury, quite often there are diffuse axonal injuries to a point that the visual system is affected. As we all know from our anatomy in grad school, 80 to 90% of the brain contains connection to the visual system. So whenever there's injury or trauma to the brain, quite often these vision problems develop.
Yeah, definitely. Yeah, we've seen that too with when you have the same kind of injuries with the head neck area that can affect with those cranial nerves, especially 4, 5, and 6 with eye movements. And so we've seen some overlap with some of our patients where maybe they have issues with their visual system that may not clear up when you correct for the upper cervical, because it's much more complex than that. We send them your way and helping them out. So for conditions that neuro-optometry helps with, what would you say the top conditions would be that you usually see, or the typical conditions that you see people for?
Yeah, a lot of people complain about what we call the near vision difficulties that they did not experience prior to the injury. So after injury, their eyes get so tired just reading a few pages. When they work on a computer screen, they cannot tolerate it. When they are even indoor in the room, the fluorescent light is just too overwhelming. Yeah.
Oh, wow, that's I feel like it's a lot of people I've seen that like have something going on with their head neck area that could be benefiting from neuro-optometry. So when you have a typical neuro-optometry session, What happens? Just curious. When someone comes to see you, what happens?
Yeah, great question. We always start with an initial evaluation for new patient. We take into account the injury, the medical history, and any treatment they have received so far. And then we look at three major aspects. We start with eyesight and eye health, meaning to make sure they have good eyesight, or they need to adjust their eyeglasses. We make sure that is addressed. We also want to make sure from the injury it's not causing any structural damage to the cornea, the lens inside the eye, or the retina. We want to rule out those problems. And then we look in the functional aspect, which means the eye coordination, whether the eyes are working together, the eye focusing, whether it's able to maintain clarity, and the eye tracking, whether the eyes are able to move properly, and then the visual spatial awareness, meaning things like depth perception, balance, gait, posture as well. Yeah.
Oh wow, that sounds like a lot. So what are some of the things or tests, evaluations that you do to check for some of those things?
Yeah, so we do a series of binocular vision tests. Binocular means both. Binocular means both eyes, how the eyes are coordinating, how they are aligning or converging when doing close-up work. We look at how well the person is tracking, accuracy, the speed. We look at the visual spatial awareness, and based on those evaluation, we would come up with a treatment plan. Yeah.
Oh wow. Okay, good. So, what kind of treatments or how do you treat those conditions, or what kind of rehabilitation do you do for someone with those conditions?
Yeah, everyone is different. In general, we look into different possibilities. Sometimes we start with basic type of lenses in the form of glasses.
Okay.
There are special lenses for those with light sensitivity. There may be a tint to it to reduce the light sensitivity. There may be specialized lenses called prism lenses to help the eyes to be relieved from being exhausted or tired. And
those have been a big change for some of my patients that mentioned of the prism glasses. So that's those have been working wonders for some of them. So thank you.
Oh, you're welcome. So we always look to see if any of those would be a starting point with the treatment to relieve some initial symptoms. And then some of our other patients, if the problems are beyond just the lenses or the prisms or the tints, we'll also prescribe eye therapy known as vision therapy to provide the rehab process. Yeah.
Kind of like saccades, or?
Yeah, so it could be a series of weekly in-person sessions to work on eye exercise like the eye movement. You mentioned the eye saccades, the eye tracking, the eye convergence, hand-eye coordination, and visual spatial awareness. Yeah.
Okay, and then is there any side effects to neuro-optometry, like using some of these, maybe something that someone should be kind of mindful of, or or maybe cautious of, or just to be aware of with side effects with neuro-optometry?
Not really. Just like any treatment, sometimes when it's prescribed the first time, like any medication, there may be some initial adjustment. Same with the lenses, prisms. So we monitor the patient very closely and make adjustment if needed. Yeah. And
That's
same
really
with
good.
the vision therapy, with the weekly sessions, we would periodically monitor the patient for progress and then adjust the treatment accordingly. Yeah.
Cool. And then do you guys, what age range of people do you see? Do you see children? Do you see mostly adults, or who do you usually see?
Yeah, we work with people with all ages because concussion, head or neck trauma can happen to anybody.
Yes, definitely.
So we have some that young children, we have people, young adults, we have athletes, as well as those who have a brain injury or stroke who are probably 80, 90. I think the oldest one I've worked with is like 97, yeah.
Oh, wow, that beats me. I think the oldest patient I've had was 95, so that's good to know. And so how does neuro-optometry fit into the larger framework of like traditional optometry and healthcare? I guess how does it fit into that piece? Like when you're because people have their regular optometrists and they have their other practitioners. I guess how does neuro-optometry fit into all of that?
Yeah, a lot of our patients, they have regular optometrists that they go to for annual checkups, and quite often afterwards the optometrist will refer them to our office for the evaluation if these individuals are showing specific signs and symptoms. Yeah. Mm-hmm.
Oh, okay.
Yeah, so we collaborate and perform the additional evaluation treatment. Yeah. Mm-hmm.
Okay. How is there any extra schooling that you have to do to become a neuro-optometrist aside from going to optometry school?
Yeah, so for many of us, after 4 years of undergrad college, 4 years of optometry school, after all the licensing, state and national boards, some of us choose to pursue postdoctoral residency training. So mine was in pediatric optometry and vision therapy, helping people with similar of these eye problems. And many of us, in addition to that, will pursue additional fellowship training or postgrad training through either the Neuro-Optometry Rehab Association or the Optometric Vision Development and Rehab Association, and become a fellowship trained. Yeah. Just like the new care specialist in chiropractic. Yeah.
Yeah, just like us we do with NUCA. Did you go to UCLA for the?
I went to the Southern California College of Optometry, which is now known as the Marshall B. Ketchum University, one of the three optometry schools in California. Yeah.
Okay, I only ask because you have an LA shirt. You an LA shirt on.
That's
that's Dodger shirt. There was a Dodger shirt. There was a Dodger tie. That's a Dodger tie. Never mind. I didn't see it. But you also train other would sometimes train other optometrists, correct?
Yeah, in the past, from 2012 up to 2023, our office also served as a residency site for postdoc training, affiliated with the Southern California College of Optometrists. Yeah.
Oh, okay.
Yeah, so we did that for about 12 years, and personally trained 23 postdocs. Yeah.
Oh wow! So you made a big contribution, and as well as training a lot of neuro-optometrists out there.
We tried to be able to share my knowledge so that many of these doctors would be able to help their patients in the future.
Yeah, in a way you're helping a lot more people than the people in your clinic by doing that. You're having a big impact.
Thank you. Yeah.
And now, if someone is thinking of doing neuro-optometry, how can they find you?
Yeah, probably the best way is to go to our website. It is www.tongvision.com. Yeah, that's www.tongvision.com. Yeah, so with the website we have all the new patient informations and the instructions to request appointments. Yeah.
Great. So we'll have that information available as well, and the details from the podcast. Well, this is just another episode of Just Warrior It, where we want to think your health is worth fighting for. Again, this is Dr. Tong. I'm Dr. Jameson Wong. Have a good one. Thank you.
Thank you.